So, I wanted to take just a few minutes to discuss a little bit more about depression and anxiety in the church. And I will try and come on here at least once a week so that we can have a little bit of a discussion, so that it's not just about me trying to sell you a book, that you really do get a deeper understanding of what it is that I'm trying to get out there, what conversation that I'm trying to start so that you can have that level of knowledge. So one of the things that is immediately something to discuss is going to be the difference between a depressive mood and actual clinical depression, because I think a lot of people get confused with that. And when they get confused, they tend to make comments or suggestions that really do not go with the actual issue that's going on. So I'll give you an example of each so you can kind of have an idea. And I won't be here long. Just want to make sure you have some information that will help you to understand a little bit more what kind of dialogue you should be having with someone. So a depressive mood generally really is kind of a sign of grief. So you'll think of a depressive mood for something like you broke up with your boyfriend or your girlfriend, or someone passes away, or you lose your job. Those are depressive moods. In other words, something has happened to make you sad, and that sadness has turned into more than just a 15-minute, 20-minute situation. Generally, a depressive mood lasts around, I don't know, a week, maybe two, depending on how severe the issue is. Now, with something like death, obviously that can reoccur because people grieve for extended periods of time, but it's not a real long ongoing grief. It is, okay, for a couple of weeks I felt really, really bad. Now I'm starting to get back to normal. And then every time, maybe when you think about that particular event, you may feel a little bit of sadness again about it, but ultimately it doesn't change the way you function. Now, depression, as far as mental health is concerned, when you're dealing with a clinical depression, it's not something that is, or sometimes it can be, but it's not generally something that's triggered by something else. Clinical depression doesn't really have to have a specific cause. Sometimes you wake up in the morning and you just feel the weight of the depression. One of the things that the depression can do is make you very achy, very exhausted, lose your appetite. And those are things that can come with a depressive mood. But the real difference is longevity. So if after a couple of weeks you still can't shake that feeling of depression, and you find that that happens a lot for no real apparent reason, then you may actually have clinical depression. And that's something that you would need to see a medical professional for. Now, I definitely am all about prayer, and I know that God can heal, but you need to see a doctor. The bottom line is that it's the same way you would treat something like high blood pressure, for example. So with high blood pressure, you go to the doctor, he tells you your pressure is off, it's too high. And there are a couple of different things that he can try. Either A, once he sees you, he may tell you, okay, well, it's not that bad. You really just need to cut back on your sodium intake, do some exercise, eat a little bit better. You should be fine. You go back in, you have another checkup, and he'll say, yes, it's better, or no, it's not. And then at that point, he'll have another discussion with you about the next course of action. The same exact thing is going to apply when you're dealing with something like clinical depression. You're going to go into the doctor, and the doctor is going to evaluate you based on what you can tell them. So please be honest with your doctor, your physician, your therapist, so that they can really help you in the best possible way. They're going to say, well, you know what, this is really mild, or this is really treatable. Let's try this. Let's try some exercise. Let's try changing your diet. Let's try those things first. And then when you come back for a follow-up, if the depression still doesn't subside, they may need to prescribe some medicine. I don't know why we take the time to classify mental health as something completely different from our physical health. It's really all holistic. There is no real weight between how you take care of your body and how you take care of your mind. The process is the same for each. And honestly, there really should not be a stigma about something that is so common and common to all of us. But I digress. Anyway, the point is, when you have depressive mood, that's something that you can really get through very easily by thinking of positive things, connecting with family, connecting with friends, prayer, great scriptures. Those are the things that you can use to help you if you're having a depressive mood, if you're grieving something or the loss of something or the lack of something. But when you have clinical depression, you can continue to do all of those things, but it may not immediately get rid of the depression that you're feeling. And so if that happens, if it's been more than a couple of weeks and you're still not feeling any relief, you've been praying, you've been reading your scripture, you've talked to people, you've gotten some support, and still you feel the same way, you need to go and seek help from a professional, just like you would if it was any other type of illness. Don't be ashamed to go and find out what it is that you can do to help yourself. Educate yourself on depression, educate yourself on mental health. And once you really get to know exactly what's going on with you, you can really make better decisions. Your prayers are more focused. You know what to look for when you're looking for your scripture, for your studies. It's just really a better situation overall when you take the time to get a full understanding of what's going on with you. So just be encouraged. Link to my new book is in the bio because, I still have to sell it. Just remember, first 100 copies will be signed by myself and the other contributors, which are my two children, Donation, Sapphire. And also the pre-sale will be going on through January the 15th. And then as of the 21st, the book will be available to everyone else. So those who order now will have it. Those who order now will have it before everyone else has an opportunity to purchase it. Just saying. Have a blessed day.